Good morning, everybody. Thank you for joining us for the first Enterprise Risk Management Toolbox training webinar of 2014. We're glad to have you. A couple of housekeeping notes before we get started. If you've dialed in by phone but haven't logged in by computer and you would like to see the slides that will be demonstrated during the show, please point your web browser to readytalk.com. In the box where it says Participant Join a Meeting, use the same access code that you used to join the call, 9879821. Please stay aware of the level of background noise in your area, and if it becomes noisy, please put your phone on mute so the background noise doesn't go to everyone else on the call. And if you are called away from your phone, please do not put your phone on hold because that will transmit your hold music to everybody else on the line. I will also be monitoring the phone lines. I can individually mute and unmute if we have problems. As far as questions go, we are leaving the phone lines open. If you have questions, feel free to raise them as they come up, or if you would prefer, you can type them in the chat box. I will be monitoring that, and will relay questions to our presenter at an appropriate moment. With that, I will hand the controls over to our presenter, Sean Catanese. Sean?
Thank you, Emily, and also thank you to our participants for joining us in this discussion of an important component of the UCOP Risk Assessment Toolkit. Now, before we go much further here, I want to sort of discuss how the Risk Assessment Toolkit works in general. The UCOP Office of Risk Services offers several of these Excel-based workbooks to meet a diverse set of risk assessment needs across the UC system. Each of these tools has been constructed to provide insight from multiple perspectives, and for a complete list of the tools that are available as part of this toolkit, you can refer to the ERM website that's hosted by UCOP. But let's actually talk about the one that I'm presenting to you today. So the tool I'm showing you today is called the Protected Health Information Value Estimator. If you make that an initialism, it comes to PHIVE, but we pronounce it as the acronym FIVE. Now, FIVE is one of two tools that we've created that uses a very similar methodology. The other tool doesn't have a slick acronym, and its functions are so similar to this one that for its title we simply replace protected health information with protected information and intellectual property. However, it does address genuinely different aspects of risk. So to minimize duplication here for the purpose of this presentation, I'll be going through FIVE first and then returning to the protected information and intellectual property version to highlight the differences there only. So the purpose of this tool is to help personnel responsible for maintaining the security of protected health information as they try to understand the financial impact of a breach. Now, FIVE is intended to help these stakeholders really evaluate and recommend the appropriate investments necessary to mitigate the risk of a breach. This also helps reduce the potential financial exposure, but also strengthen the organization's reputation as a protector of the health information entrusted to its care. And the methodology is actually described in greater detail with examples in the American National Standards Institute publication titled The Financial Impact of Breached Protected Health Information. ANSI's publication is available at the ANSI website, and you can actually get it free of charge from them too. I'm going to just show you briefly what the cover of it looks like and a couple different aspects of it so you have an idea of what you're looking for there. Let's see here. Just going to okay, and I believe you should be able to see the cover page now. Is that correct?
There's a little bit obscured at the bottom, but we can see it, yes.
Okay, very good. So that is really what the cover page of this looks like, and I'm just going to show you one quick version of what they call their example here. This is the calculations that they go through to describe this. Now, the spreadsheet that we've used here, the Excel document that we've created, goes through this process and sort of automates it and also allows you to do this for multiple protected health information homes. Now I'm going to close this out here. We'll go back to our slides for just a moment, and then we'll jump right into the tool in Excel. apologies for that minor delay there. All right, so now it is important to understand that this tool here is designed to help you make better decisions, more risk-aware decisions, but it will not tell you what the right answer is. And these tools function to support a methodical thought process that can be consistently applied to thoroughly evaluate various risks and enable the user to make better informed decisions. But the nature of a risk assessment is really highly subjective. It only provides a user's perception of risks and related impacts. So it's important that when we have additional data that we can evaluate, that we do take the time to evaluate things that might be correlating, other aspects of data that are available to us within our organization that can help us validate these assumptions and help us better understand this risk beyond just what the tool asks for. Now, the tool does try to get a pretty comprehensive view, but again, there's a lot of data out there that you can really use to help you in making these decisions, and so we encourage you to look outside the box also. And of course, as we're all risk owners, as enterprise risk management is also that everyone's a risk manager, we are responsible, that is, the users are responsible for the final decisions that we make here. So just please bear that in mind as we go through. I'll also mention that if you're interested in using the tools that we discussed today, you can talk to the ERM help desk. That's at erm@ucop.edu. Again, I'll say it slower now, erm@ucop.edu. They'll be happy to get you in touch with the versions of these tools that we have either available to the public and also our internal users here at UC. So next I'll actually go to is the actual tool itself. And all right, it looks like we're sharing this properly, and hopefully you can see what we're going through here. So Excel is what we use to build this in here. So I'm going to use this opportunity now to walk you through this tool. And we'll start here really at the introduction. And you'll see that we filled this out with some very basic information about who's using the tool. And then we also want to save this in a unique place with a unique name so that when we refer to it later, we know which assessment we're looking at and we know when the assessment was performed. So we also want to, of course, read through these instructions. Just because you've gone through the webinar doesn't mean the instructions don't matter. Absolutely they do. And conveniently, 5 has 5 basic steps to it. They're outlined down here. We'll actually go through this process, so I'm not going to read all the instructions for you right now. So we'll click the Get Started button, and we'll see here. Want to make sure that we can see this all properly at the right scale. So you'll see here that this button takes us to the likelihood and relevance page. The first thing you notice here is the navigation pane the navigation pane here, and on the left-hand side of the screen. And basically, each of these buttons will take you to a different page of the tool. It's best to complete them in order, but you can move between them as you see fit. Now, to start off, we need to set common parameters so we understand what the different terms mean when we use them in this tool. And this page allows us to sort of set our risk appetite. There are 2 tables on this page, one for the likelihood of a data breach and one for our relevance factors. The only table where changes can be made, however, is in the likelihood under acceptability. And you'll see these are shaded slightly lighter with white instead of the gray. And so if we want to make changes to the acceptability here, we can simply click on this, and we've got a drop-down menu that comes out, and we can now change, for instance, a possible but not likely likelihood from unacceptable to acceptable here. And that actually changes some of the things that we've made down the line, some of the choices and entries we've made down the line. For the purposes of keeping this demonstration consistent, this is also, I'll leave this as we found it here. And you'll also notice that there's some red text that appears here. This only appears if later pages are filled out, and for this demonstration, of course, they are. But when you first log in, that red text shouldn't be there. So So again, additional instructions will pop up as we go through this here. I don't know that the animation shows up here in ReadyTalk, but anytime you see this sort of red corner, that means that there's a note there that you can access that sort of gives you additional instructions as you go through. So let's move on to actually assessing our risks. So we just click that there, and you can see we have this larger page here. I'm going to zoom in so that we can actually read some of it. Okay, so this page walks us through the assessment process. We identify here where information is stored, how it can possibly be breached, and how we safeguard our data. And then we'll determine how likely a breach is, and finally determine relevance. Now the top of each column, as before, has a bit of additional instruction here. But we start by listing our organization's protected health information homes. These are the physical or electronic locations where this information is stored, accessed, disseminated, or used. And then we move on to, so that's in this one right here, but then we're going to move on to describing potential risk events for each home. We need to ask ourselves sort of how might the data be compromised? How could a breach be created? And these may be common from one home to the next. For instance, you can see here that we've identified fraud as a potential risk event for the accounting department and for audit. The other thing that you'll notice here is that we're not describing these in great detail. That's one thing here that we don't want to turn this risk assessment into a roadmap for someone else to come in, perhaps a malicious actor from the outside, to come in, find this assessment itself, and then use this as a roadmap to attack our organization. But we do need to still make decisions in a truly eyes-open, aware environment. So ignorance of the risk events itself is never a defense, and we need to really understand how these risk events can affect our organization, but at the same time, describing them in a general context instead of a specific context, such as, you know, this server's patch is outdated and we can't update it for the next 3 months, and that produces a problem for us in the future. We don't want that level of detail in this assessment document at all, of course. So, with that out of the way, once we've listed our homes and listed our potential risk events, then we want to list our vulnerabilities. And here we really are asking, what does a failure of a control look like? How does it manifest? What creates the circumstances under which a breach becomes more likely? And then we get to our safeguards. And I'm going to scroll over here. Of course, in normal non-webinar view, you can see all these columns all at once, but we'll have some movement to side here. So in our safeguards, in this section here, what we're really asking is, what do our controls do? How are they implemented? And we used this space to describe that. And under likelihood of a data breach, then we have here each cell containing a drop-down menu. And we want to select the appropriate scale here corresponding to basically really what we believe the likelihood is. And again, we used some common definitions of these on the previous page. So if you need to take a look at those, by all means, we can click back and take a look at them. But here we've selected rare for a breach in this home here. But again, we have these selections available to us. Now, each one of these selections, depending on what I select here, gives me a different security readiness score. So for instance, if I change this from rare to possible and likely, you'll see that the 2 changes to a 4, and acceptability now turns unacceptable. I'm going to change it back to rare here. But this is how we sort of prioritize which homes we need to look at when we're looking at our repercussions now in the future. So in these next pages that we're addressing here on repercussions, you'll see that we actually skip some numbers in this leftmost column. That's because this page will only show us the protected health information homes that have a security readiness score that is unacceptable. So that's why we're skipping lines 1 and 2, 4, line 6, etc. So when we go back here, those are green here. And so we're not going to be addressing them. It doesn't mean that we need to just ignore them completely. Absolutely, these are places that contain information that we care about protecting. However, for our focus here, we're going to primarily focus our efforts on places where we have an unacceptable security readiness score. Okay. So let's go into repercussions. So now we're evaluating each protected health information home with an unacceptable readiness score. And the first three columns here are simply showing what's been entered in your previous page. Again, we have unacceptable. All of these are things that we've selected in the previous page here. But then we get into, and really, relevance here. Let me just go take a step back to the ANSI methodology that we're using for this. Relevance here matters because there will be cost categories that may not be relevant to one type of organization, but are extremely relevant to another. So this will vary from organization to organization. It's sort of like a multiplier for how we look at the various impacts here. So an example of this, especially in the medical environment, would be, for example, when we're considering repercussions of reputational damage. If the work of the organization is critical to how we address relevancy. For instance, a lab imaging company may not suffer as severe a reputational impact as a single physician practice, because that single physician practice is highly dependent on the reputation of that single physician. And if we're looking at, for instance, a fulfillment company, the financial impact of a data breach might not be as severe as if there was one suffered by, for instance, an entire hospital. So again, organization and scale matters here. So under reputational repercussions here, our next step really is to start estimating the costs of a breach. So under loss of patience, and I'm going to scroll a little bit here too, under loss of patience, we start really by noting how much revenue we stand to lose per patient and how many patient switches might occur in the event of a breach in each home. And we also want to consider the potential for viral social media to influence patient decisions here. Now, the viral social media is just a factor from 0 to 1, and it's treated as an additive multiplier to the number of switches. So if we say that we're going to have 300 people switching because of a breach in this home here in our billing department, and that factor is actually going to be increased by a factor of 0.25 or 25%. Based on these people sharing this information with their friends and saying, because they screwed up in this area, it matters. You'll see that we actually have a different viral factor for different homes here, and that's because some losses are treated differently than others in terms of reputation. Sometimes a news media outlet may not actually be the first on the scene when it talks about a data disposal facility or our facilities folks that are taking out the trash. But when it talks about our medical billing, they might be more responsive there, and we might actually see more coverage there. In our clinical treatment areas, where the hospital, where the rubber meets the road, that is, that's actually another place where we can see perhaps a larger viral factor. So that's why we have variation here. Now, beyond patients, there are other customers that each of our organizations have. And these are sort of structured much more generally in terms of how we would think about them. But again, another customer might be someone we have a strategic, someone that we would have a long-term arrangement with, and we might have a larger agreement with them. So again, this is other current customers that we might work with. Could be switching, and we want to know how they would switch and what we're losing when they do. Then also new customers. Again, who are we losing, and what are we losing in the future here too? A loss doesn't just impact us in the here and now, but it impacts us going forward. So we want to make sure that if people are being diverted to competitors or other service providers, that we can address that and capture that in these purple columns here. Excuse me. And then we also have strategic partners and staff to consider as well. So a strategic partnership, for that we have a slightly different approach. There's a margin per partner to consider, and again, the number of partners we may lose. And then for loss of staff, this is actually an important part here, where we're talking about people who leave based upon simply leaving based upon the reputation. This is not, for instance, the person responsible for the breach who may be leaving the organization. This is someone who feels like they don't want to any longer be associated with the organization as an employee or as staff, so they would leave the organization in that case. That's maybe in the current job market, maybe a slightly less likely thing to happen, but again, it's something to consider. So this is reputational impacts and repercussions here. We also go through financial repercussions, and I'll again touch on this briefly. The reputational ones are probably the most detailed because they are also some of the hardest to really quantify and think about. We're thinking about not just so many different stakeholder groups, but also in these other areas, we have regulations to guide us in terms of what things actually cost us here. So the strictly financial consequences of a breach, as before, we have a relevance here. Again, but then we're also wanting to list our costs of remediation. These are things like identity theft notification, response to that, and also monitoring. There's additional communications, such as if we have to have an investor relations campaign or something like that. Insurance costs might also increase after a breach, in which case we want to capture that potential expense here. And when we consider the costs associated with changing associates in this context, it's intended to capture the cost of ending a partnership as a direct consequence of a breach. So for instance, if a subcontractor with a role in the breach has its contract terminated and a new subcontractor is needed to fill that role, this is where we capture that. And it's distinct from, again, the reputation-related losses that we identified on the previous page, where instead we might have other associates that may not want to work with us because we have a hard time keeping track of and securing the data that's entrusted to us. Now, although business distraction is difficult to calculate, a breach does create a real cost in lost productivity. In its methodology, ANSI cites a report which estimates a cost of $30 per record in this category alone. So again, the scale of a breach matters here, but this is the additional time that your organization is going to be spending instead of doing the job that it does on a day-to-day basis and completing its mission, instead being focused on a breach and controlling the fallout of that breach. And again, here we have each of these these impacts summed. You notice that these amounts vary, even though the line items across here are the same. That's because relevance here is a multiplier. So if something is hardly relevant, then its multiplier is much lower. So it's not just a straight sum across. We use these as multipliers. Okay. So let's move on to legal and regulatory repercussions. So here, again, we have our homes, our readiness scores, and our relevance. And here, excuse me. So we're starting here in the fourth column with OCR fines and penalties. So this is for the Office of Civil Rights. Also, the fines from state, if the state gets involved. We also have cost of a lawsuit and potentially the cost of loss of accreditation, and especially for medical centers here, that is especially a salient type of risk here. Now, it's important, actually, when we talk about the Office of Civil Rights fines and penalties here too, that there are, in the ANSI methodology also, oversight authorities may include more complex costs, such as remediation or restructuring, where costs can be calculated across different factors and multiple years. So this tool here does only use a single number in this column, but you do want to keep in mind that that the situation actually may become more complex depending on your situation and your regulatory environment. So let's now move on to the operational repercussions. Okay. So here we have some relatively simple calculations. You can see here there's not much scrolling involved. As with the other sets, again, we have relevance and the other columns on the left, but our three costs here are simply new hires, recruiting and training, and reorganization. In each of these cases, these should reflect the cost to the organization as directly related to the breach. So for instance, if a breach would result in involuntarily terminating an employee and finding a new employee to fill that role, this is where those costs get captured. Okay. The same goes, of course, for reorganization. So our last set of repercussions here are our clinical repercussions. And a data breach can really have some interesting and different types of consequences when it comes to how we operate clinically. The three cost areas here, are fairly straightforward, though. They include fraudulent claims activity, and also the costs associated with diagnoses that are delayed or inaccurate, and then also the potential consequences of using bad data in research. So again, as research is one of those missions for University of California Medical Centers, certainly we definitely have a potential involvement here, and we want to capture those here. Again, as with all of the figures here, I should just put that caveat out, that all of these figures here, these numbers, are just placeholders. They're intended for people to see how this tool works, but again, please don't assume that because we don't have anything in these columns here that we believe in this case that there is no risk there. That's just, again, part of the showing you that even a zero calculation here will not break the tool. So finally, when we go into our summary, we can see a summarized view, and this is a very simple view of a really complex set of ideas that we've put into each of these steps of the tool here. We can see, again, our security readiness score and each home with that unacceptable security readiness score, but also the total impact across all of these different kinds of repercussions summed here for us. So again, we're hoping this tool helps you in your endeavors to identify the potential costs of a breach of protected health information, and that this awareness drives positive action in your organization as it addresses risks. Now, this is just the end of the protected health information value estimator here. Let me now change gears real quickly into the protected information and intellectual property, and I'll sort of highlight the distinction here between those. And see, Emily, can you just confirm for me that we are able to see now the protected information and intellectual property side of this instead?
Yes.
Okay, very good. All right, so again, you'll see that it's very similar, and again, it uses the same sort of methodology. So I'm going to skip those earlier pages here and just go straight to outlining. You'll see that clinical repercussions don't exist here because, again, we're not dealing in a clinical environment. We're dealing with protected information and intellectual property in this case. So here, reputation is actually calculated in a very similar way. We have customers, we have current customers, new customers, strategic partners, and staff. So we have that all listed here. That's fairly similar to what we had before. But under financial repercussions, instead of the Office of Civil Rights fines and that sort of thing, because we're dealing with our own information, information that we have invested in and created ourselves, the consequences are a little different here. Instead, we're looking at the cost of information retrieval or reconstruction. This is, for instance, if we need to hire a data recovery firm, if we need to, or if data is simply lost, there's an inherent value to that data. Also, this is actually kind of similar to our health information examples. We do need to usually have some sort of a plan to mitigate how the rest of the world sees this loss on our part, if it is in any way a public sort of loss. So cost of communication is here. If we've insured our data somehow and there is a loss, chances are that our insurer would come back to us and say, well, we may need to increase our insurance costs, again, depending on our history there. Again, changing associates and business distractions, again, those are similar to our protected health information examples. In legal and regulatory repercussions, again, fines and penalties, it really doesn't come up too often when we're talking about our own data or intellectual property, unless, for instance, we need that information or data to be in compliance with some sort of regulation. So if this is a loss of our compliance information, for instance, if this was a loss of all of our training records, then an OSHA came knocking and said, well, where are your training records? And we said, oops, we lost them. Well, there are probably fines and penalties associated with that. Also, when we talk about costs of a lawsuit, again, if we're working with someone else with regard to intellectual property, and again, because we work in an accreditation environment in higher education generally, we do retain that there. Now also, when we're talking about operational repercussions, we have not just new hires, and this is also where we have some differences between the health information version of this and this version here with protection information and intellectual property, is that our delayed service delivery here, instead of just diagnoses, it's actually service as a whole can easily be delayed if we lose data along the way. And also, it's not just claims being processed, but it's fraudulent activity. Again, if we're losing a database of information that helps us validate our users, and now users are able to sort of get into and obtain services from us without paying for them for some way or something like that, fraudulent activity, that would go here. Again, we have reorganization, additional training, other costs and consequences here. As before, we use relevance as a multiplier to identify which of these is actually going to impact us in the greatest ways. Okay, so as before also, we summarize here. So again, it's using a very similar methodology to ANSI, but it does it in a way that allows us to really address multiple places where protected information might exist within our organization, and at the same time, it gives us a way to prioritize our efforts. That's one of the things that really we face on a daily basis here is diverse priorities and also priorities that very quickly can outstrip our resources to address everything. So we need to prioritize and understand which ones we need to really address first or foremost with our efforts. So again, I've sort of gone through this here on both of these tools. I'm going to go back to our Ready to Talk environment of slides and such. And really, I think at this point, if we have questions here, I'm happy to answer any questions you have about these tools here, about the ANSI methodology, and sort of how we've applied it for protected health information, for intellectual property, and also for other information assets.
The phone lines are open, but it doesn't sound like anybody has any questions at the moment. So with that, I think we will wrap this up. As Sean says, if you have any questions about it, would like further information, please contact the ERM Service Desk, erm@ucop.edu. Thank you very much for joining us, and we hope to see you for future Toolbox webinars.
Bye.